That's great. Yeah. All right. So, Dr. Ishan, the registrar is in Obs and Gynae in Nottingham University Hospital. So this is like a quality improvement project for strengthening engagement in gynecology audit and quality improvement projects through weekly multidisciplinary meeting. So is so our audit lead, Mr. George Bug, was the lead consultant, and I was coordinating. So the introduction to this project, so it's a quality improvement project. So we utilize the PDSA cycle, plan, do, study, and act um, cycle for systemic improvement. So and actually the main aim of this project was to address the gaps in departmental communication and collaboration, and also the goal was to uh, have a culture of shared learning and engagement. So the background was before 2024, there was no consistent platform for sharing audit work. There was sometimes, the attendance was uh, not adequate. So because of that, there was lack of awareness among team members. So there was limited interspecialty collaboration and missed opportunities for shared learning across the department. So so regarding the ongoing projects, the knowledge was fragmented, and the participation was very low, and also sometimes there were potential for duplication efforts for quality improvement projects because lack of awareness about the ongoing projects, and so there was a need of structured approach to bridge this gap. So the primary aim was to improve communication, visibility, engagement with audit and QI projects across gynecology department. So the method was to introduce a weekly multidisciplinary meeting and to increase the collaboration, awareness, and participation. So yeah, the plan do study and act cycle PDSI cycle. Um so the plan was to identify issue and plan the intervention. So do is to implement the change, studies to analyze results, and act is refine and standardize. So the plan phase, we identified communication gap through departmental feedback, designed a short regular meeting format, so open to entire gynecology team. And also the obstetric team also was invited for the meeting. So the focus was to have a low barrier participation to encourage sharing the knowledge. And the do phase was launched in August 2024. So weekly we had 30-minute sessions every Wednesday, 8 to 8:30 a.m. Invitations to all subspecialties, fertility, urogyne, gynae onco, early pregnancy, benign gynae, and also obstetrics were sent. And so participants were professors, consultants, resident doctors, specialist nurses, ward managers, allied professionals, including midwives. So we issued a certificate for the presenters to encourage them to present. So the study phase, uh, so uh, we studied the attendance weekly to this meeting, collected feedbacks via uh, surveys, and also record the number and diversity of projects presented, and then analyze the trends in engagement and participation. The act phase, so based on the positive feedback and rising attendance, we continued the weekly format without major changes, sustained through August 2025. So that's for about 1 year now. So major adjustments was that we just encouraged more diverse presenters compared to the beginning. So results, actually initially there were only 5 to 8 attendees per session, but it growth gradually, an average of 20-25 participants in about December. By about August 2025, there was consistent engagement with participation 30 to 40 day every session. So now it's about like 40 projects have been presented, so including all the gynecology subspecialties, fertility, oncology, benign gynae, so on. And so there was involvement of multidisciplinary team, doctors, nurses, allied professionals. So the impact was a broader awareness across the subspecialties about these projects. So the feedbacks about this project, there were a lot of positive feedbacks, and because there was enhanced interdepartmental communication, increased enthusiasm for its participation, and overall the high satisfaction with the suggestion for expansion. So the key, the yeah, so the we suggest that it's a good way, like if all the departments adopt these multidisciplinary forums, and then it's a low resource because it's online, and then high impact model. So it promotes Yeah, so you can like spread it, like you can have even like a regional meetings on a fixed date like that. And so that is a suggestion. We can go ahead to expand this kind of like regular weekly meetings to share knowledge about the ongoing quality improvements projects. Thank